All right, we're officially recording. So thank you for joining us today, Dina. Gregory Fisher, do you prefer going by just Fisher or?
That's a problem with that. I do go by Dina Gregory Fisher or Dina Fisher, but
okay. I was just looking at your name and your kind of tagline here. So she is the Senior Communications Manager for Communicate Health. And so she's going to let us know all about her kind of journey, a little bit more about the specific organization she works for, and also just kind of some perspective on the world and field of health communications in general. So with that, Dina, before I kind of officially ask you to some of the questions we have prepared, would you mind just giving us a quick kind of intro about yourself, kind of quick history?
Sure. So thank you, Lauren. Like you said, I am a senior health communication manager at a company called Communicate Health. We are originally located or headquarters out of Massachusetts, but now I guess our headquarters are out of Rockville, Maryland. So very close by. And but we do have now most of our folks work virtually, but even before that, before COVID, we probably a third of the company worked virtually, and we have 80 employees now. The company is a small business and started with like one person and has grown to where it is today. And kind of the big picture is that Communicate Health is a health communication firm that we mainly work on government contracts, and I can talk a little bit more about that later. But we essentially, our client is generally the federal government, but we do have state government or other organizations, private organizations, but mainly our bread and butter is with government contracts. But we actually have done some work with the University of Maryland, and I just finished up a project with Dr. Cynthia Bauer in the Horowitz Center for Health Literacy, so I can tell you a little bit more about that as well. And just some of my background is that I've been at Communicate Health. I'll be 4 years next month. Prior to that, I was with a very large consulting agency called the American Institutes for Research. And I was there for a number of years. And then prior to that, I actually worked at an advertising agency. And all of this being in the health communication space. So that's kind of my big picture view.
Thanks so much for providing that kind of high level overview of your kind of history, the company, and everything. So we're going to take it back a little bit further now, because I do know you are an alumna of UMD and SPH specifically. So would you take a moment to kind of describe, what you studied, but also what some of your activities were, and how maybe some of that relates to or started you on the path to where you are today?
Yeah, so I graduated with a degree in kinesiology, and so this was actually before the School of Public Health existed. So I predate the School of Public Health. Got my undergrad in kinesiology, and while I was at the university, I actually did some work in one of the gyms with a variety of the professors, and some of them are still there today. I guess I should date myself. I graduated in 1997. So there are, like Dr. Hatfield is still there, and I know Dr. Jane Clark recently retired. There's still some other names that are floating around there. But then I also served as a athletic trainer assistant for a while, and was supported the men's lacrosse team and the wrestling team, and that was really exciting for the time being. I thought I would go into physical therapy, and actually I really liked athletic training and exercise physiology and everything. But the one day that I missed from the being out on this field with the men's lacrosse team is one of the kids didn't have his mouth guard in, and I think he lost a tooth. So I think after that I was like, yeah, I don't really think that's for me. But but anyway, after graduating, I actually took some additional classes, still thinking about physical therapy, and then at just at a certain point, I was like, I need money. I need to get a job. So I actually applied for a job, and it was in this health communication field. And actually, I had just applied for grad school, started grad school at GW. I got my master's in public health from GW, and so I started working months after I started my grad program, and then it just fell into place from there. So I never pursued the physical therapy, and just kind of like that first job led me to where I am now.
Awesome, thank you. And so that kind of tailors a little bit into and kind of give a brief intro to our next question, which is, how and when did you decide to jump into the field of health communications? And then how did you kind of first make that jump? So I'll let you I know you kind of just answered that, but if there's anything else you can add, given kind of the framing of that question.
Yeah, sure. Like I said, I had just started grad school, and at the time too, I was working in a restaurant. So I had applied for this job, and I remember my first boss, I think she said something like, she was excited to get somebody who was young and new to the field so that she could convert an advocate for life kind of thing. And this was like in the time of tobacco control, which I had always been, growing up, anti-tobacco and anti-smoking. And this is when it was really going towards going to smoke-free states and that kind of thing. This was right after the master settlement agreement with the tobacco companies. So there was a lot of money that was being funneled to the government to put together these tobacco control initiatives. So I think it was kind of being at the right place at the right time, and having this mentor and manager who just saw, like having a young advocate that she could just instill these interests and everything in me. I mean, it was like, or help me explore my interests at that time. I would say probably at that time, I had no idea that even health communication was a thing. It was a different period in time. Well, and especially with COVID now, everybody knows what public health is, right? Like that word is just thrown out there all the time. But back in the day, it was new to me, and I think just based on my interest and skills, being I'm just a planner by nature. So as I noted, I'm a health communication manager. So really, we'll talk about this later too, is a lot of what I do is project planning. But it is all tied with health communication and the principles in health communication and the theories and all of that. But I do a lot of organizing and planning, and that I would say be my main job. And I would say that's how I made the jump into the field. And then I had some friends who did go into physical therapy. Others had graduated with the kines degree. And I think in the end, like where I am today, I'm very happy, that I went in this direction versus kind of doing the more hands-on interpersonal, like working directly with patients or that kind of thing. And I should say too, when I was in college, I did spend time as a physical therapy aide as well. So I did have that experience, while I was pursuing other things as well.
Great, thank you. I'm actually going to throw a little bit of a curveball, because looking at the questions I sent you, I realized that I had not added one of the ones in that I actually wanted to. So hopefully you'll bear with me here, but I think it kind of tailors to what you were saying about kind of getting in at a time where maybe public health wasn't the buzzword it is today. Maybe health communications wasn't even like a field necessarily. It was just what you were doing without really having the title. So the question is, how would you define the term health communications? And what do you think is something or that people misunderstand, or just what is kind of generally misunderstood about the field?
I'm on mute. That's a good question, because I was just thinking too, is one thing that I haven't talked about is kind of this different campaign work. I did talk about the anti-smoking or tobacco control, but in my mind, with everything that I've done, I've been really campaign oriented. So I have worked, well, when I started out in the anti-tobacco, and actually at that point in time, I was working with the CDC as a contractor. And we were developing a guide or a booklet. It was like the guide for youth tobacco cessation. So that's one form of health communication, is like getting forums together and listening to experts and pulling together recommendations and best practices and that kind of thing. And then following that, I actually got to work on a statewide anti-smoking campaign called Maryland Smoking Stops Here. And so that's when I moved to the advertising agency, which was up in Baltimore. And I probably spent 5 or 7 years working on this anti-tobacco campaign. And by campaign, that's kind of, like I said, my bread and butter, where we were putting together the website and fact sheets, posters. At the time there wasn't social media, but we were going out doing outreach events, and we had some guerrilla marketing stuff. We partnered with radio stations. We had ads going on radio and TV, and we just had partnerships going with different organizations throughout Maryland. We partnered with all of the minor league baseball teams, and then we also ended up having, like I mentioned, the radio station. We partnered with them to host it's the smoke-free battle of the bands, and we went to Six Flags and had an event there. And we collected throughout the state of Maryland. People submitted their band, a song or whatever from their band, and we had professionals in the industry who actually rated them. And then we went to Six Flags and actually had a battle of the bands. And we had this guy never took off, but Howie Day, the radio station got this musician. He had one good song, or one song. I didn't really like it, but anyway, he came out and performed there. And then and then I also did, this health communication can go in all different ways. So I also worked on some Medicare work. So when Medicare Part D, which is the prescription drugs for Medicare, came out, our group went all throughout the state to provide information to seniors about this new benefit through Medicare. And then we helped sign seniors up for their prescription drug programs. And we held expos and that kind of thing. And then and then I worked on a few different HIV/AIDS campaigns with the Centers for Disease Control, again, working with them again. And now I am working on a physical activity campaign called Move Your Way, which is the first time that I've kind of gone full circle back to something related to kinesiology, physical activity. And that really always has been my passion, but it took me a long time to get to that content area. But I'm very excited to be there. So that's just one, or I mentioned a few different kind of health communication things there, but like I said, doing these actual campaigns, there's doing events, creating materials. At Communicate Health, where I work, we do a lot with health literacy, and everything we do is based on research. We do a lot of everything we develop should be tested with the user or the intended audience, to make sure that we are developing products that meet their needs. But then also we're developing materials and writing the content at a certain level, and so that it is clear so people can understand it. And that's kind of a newer concept, I would say, in the past 10 years, just really trying to focus on making clear and easy to read and digestible content and materials for individuals. So that's kind of like a broad brush of what I would say I see health communication as.
And then is there any component that you think is kind of misunderstood about the field of health communications more broadly that is kind of like an important element of it? Or do you think at this point everything is pretty well defined?
No, I think there's probably a lot still misunderstood, or things that people and agencies are doing that are not good. um, so again, our Communicate Health has done a lot of research, and some of the things I'm thinking about is like the way like something may be posed to an end user, like don't do this, but maybe we shouldn't be saying don't do this, as opposed to be like do it this way, just being more positive. There's been research around, we're calling it a bite snack meal approach, where like you just give a little bite of a little tidbit of how to make a change, for example, and then the snack would be a little bit more like, so your bite would kind of reel somebody in, and then your snack would be give them a little bit more information, and then the meal is like, oh, here's a poster, or here's a website with all this information, so you can take as much as you want. There's a lot of times we work with researchers who, let's say at NIH, or and they're in the lab doing research, and they think that their information is the most important, and all of these stats have to get into a document. But the end user doesn't understand stats. A lot of people don't. We may, because we're college educated, but it's trying to. There's still a lot of, I won't say misinformation, but it's like misinterpreted or mispresented to people. So a lot of times, this information just may go down the trash and no one even sees it or digests it, even though it's really important information. So our company, Communicate Health, really tries to, or does, take all that information, synthesizes it, and kind of spits it back out so that it's more understandable and digestible.
Awesome. Thanks for sharing all that awesome information about kind of your perspective on the definition or the different roles within the field, and then also on kind of some misunderstood things both within the field and I guess kind of about the field. So you've already. Continue.
While we're chatting, I will just in the chat, I will put some links. I don't know, will everyone be able to see the chat?
Yeah, it does look like it went to everyone.
Okay.
So I think, yeah.
I'm just gonna put a few things here, so you can just look at those while we're talking.
Yeah, and I will also be sure to send these in my follow-up email that includes the recording too. So if any of the students here today want to check out some of these resources specifically about Communicate Health, then you can click on them here, or I will follow up with them afterward. So you've gone and you've touched a lot on kind of what Communicate Health does. So the next question, I don't know if you want to kind of follow up on anything more specific or highlight like a specific project and some of the different deliverables, for example. But so the next question is to describe your current role as Senior Health Communication Manager, and discuss the type of work that Communicate Health does.
Sure. I'm just looking at one of the links I sent, but
and if it would be helpful to share your screen, I could let you share your screen.
Yeah, I will do that in a minute, because I think then I can show you the specific campaign that I'm working on right now. But as I mentioned before, as a senior health comm manager, well, we actually have, and I'll just, again, like at Communicate Health, we have different levels, and obviously I've been in the field for quite a while, but generally folks out of school, with their undergrad, would start as a health communication coordinator at Communicate Health. We also have some social media coordinators, and we have, which is a different position than the health comm manager, but we all work under the health communication department. And then we have the coordinator, and then an associate, a manager, and then a senior health comm manager. And we all, it's varying levels of these types of responsibilities. But like I mentioned, I'm essentially a project manager for multiple large tasks or contracts. And mainly I work with the Office of Disease Prevention and Health Promotion. And that's based out of HHS, which is the Department of Health and Human Services under the US government. And the acronym for the Office of Disease Prevention and Health Promotion is ODPHP, and they're located here in Maryland. And I think the majority of their office is also in Rockville. I will say that being in Maryland is a great location to work with these different government clients. The CDC is in Atlanta, but anyway, we have access to just so much right here with HHS and then also with NIH. And as I mentioned, most of my work is campaign related. And so as a project manager, I'm doing a lot with, we start from the beginning with identifying audiences and goals and objectives and working with the client to kind of work them through a process to identify these different strategic groups and goals and everything. And then also working with them to identify partnership strategies and then also thinking about stakeholders and partners. And then we work with a variety of vendors. So as a project manager, I'm required to help set strategy and identifying staff on our team who can work on these projects and developing and managing timelines and budgets. And so I mentioned the, kind of the ladder of progression for employees, but as a coordinator, you come in and you're really, as it says, is like coordinating, working, getting, setting. We have a lot of meetings. I think probably just as many as pre-COVID times, but now at our company, we're on camera all the time. But we have, we're scheduling meetings with a client and developing agendas and talking points to kind of, like I said, set this strategy. And then once we get into finally making materials, we have at Communicate Health, and I think a lot of companies are like this, or where I've worked anyway, is the different departments are, we have the project managers, we have a whole content team who is solely responsible for writing the content. So I don't generally write any content that will make it out to the public. I'll write these plans and everything, but I don't write consumer-based content. And then we have designers who then create the visuals. And at Communicate Health, we actually also have UX designers, which is usability designers who are really focused on what the end user will see. And they have that expertise and understand the best practices in like, this is how it should be laid out. This is how it should function, kind of thing. And then we also have, like I mentioned earlier, we do research we do testing and studies, and we do materials testing and usability testing and everything on the products that we create. A lot of companies do not do that, and a lot of the government clients do not pay for that. So we are very fortunate to be able to support the materials that we are putting out to the public, have that support of research. Like, this has all been user tested, and it is based on what we heard in research. So anyway, we have researchers, and then we also have our products department, which is like our developers, our web team, who does kind of all that back end of setting up websites or preparing materials to post online, kind of thing. So my role as a project manager is really to oversee all the work that's being developed and working with all these different staff and departments to work the products from start to finish. And as I mentioned with the campaigns, is setting strategy with the client, then actually developing messages. We actually do formative research a lot too. So we'll learn about what messaging the intended audience will resonate with them. And so we do the formative research, then we develop messages, and then we test those messages. We develop the materials, test the materials, and then we finally get to the point where we're actually going to launch the products or the campaign. And so that's kind of the big picture there. And then we also set benchmarks and metrics to then measure everything that we've done. So I will share my screen.
I made you a co-host, so you should see a share screen button and just be able to do that.
I'm debating what to share, but I'm going to share. This is on the link, the portfolio link that I sent you. So you can share. Okay, can you see that?
I can see it.
Okay, I'm assuming everyone can.
Yes.
Okay. Okay, so this is on our Communicate Health website. This is the Move Your Way campaign, which I mentioned previously. I came to Communicate Health when this had actually already been in like 2 years of formative research. But the Move Your Way campaign is based on, or is a promotion of the guidelines, or the physical activity guidelines for Americans, which was, it's a second edition, was released in 2018. So I started in 2017. And during that time, Communicate Health had already done, actually it's listed here on the left-hand side, like we had already done a ton of audience research, brand strategy, and the brand being the Move Your Way, tagline, the way it looks, everything. So we originally got feedback from users on what tagline would be motivating, and then developed multiple logos and tested those. And then, so this is where we ended up with this Move Your Way logo. And then we're also in Spanish. And so anyway, we talked about the content strategy for health. And these are some of the materials that we came up with. What we found out is, what are some of the barriers and facilitators for people to move your way? And move your way really means that you can get your physical activity by doing almost anything, and every little bit counts. And so those kind of key messages were tested. And people really like that. They didn't want to think like, and we tested with teens too. With teens in particular, they didn't want to, a lot of teens think, oh, you have to get your physical activity from doing sports. Well, you don't. You walking to school or talking to your friend while you're walking totally counts. And even with the dots, like you'll see a lot of our materials end up being, you can do a few squats while you're putting laundry away, or gardening counts, walking. I already said walking, but there's just a ton of different things that count. And then based on all of our testing, that's how we got to these messages. And our campaign actually is really geared towards, this is based in health behavior theory, is to the contemplators who are just thinking about getting into, they're thinking about making the change. So we're not really gearing our messages to those who are like, have no intent of, they're not to the pre-contemplators, but really those who are ready to take action. And not to those who are already running like 5 miles a day. These are really for the folks who are just thinking about getting active. So these are all this is kind of just a collage of all the different materials that we've created. Our main audiences are adults, but then we also do older adults, parents, and then we have some materials that are, the content is related to teens and to kids, but they are not for teens or kids, because we know that teens and kids do not want fact sheets and posters and that kind of thing. So what I'm showing here, we actually have an online tool that we developed, and someone can go in and choose how they want to be active. There are different motivators and facilitators, and those are, like I said, all based on research, and then you can select whether you want to be active with your friends or family or by yourself at home, kind of thing. And then by doing that, it ends up populating with a few different cards, and you can end up choosing how long you want to do each exercise, and we don't like to call it exercise, or do each physical activity. And then you can print out your plan. So this is, I know there's a lot of online tools for folks, but this is just another way that, and it's not intimidating at all. So people can go in and kind of see how their time would add up. Oh, one other thing that we did as part of this campaign is, for 3 years now, we've done a community pilot, and we worked with specific communities, and they implemented the campaign. So they were pilot communities. So we've been testing this over the past few years. And then fiscal year 2022, which just started in October this year, going forward will be our first year without pilot community. So we're taking all that information, everything we learned about how do you implement Move Your Way into your community. Now we're basically putting all this in the implementation strategy together so that others can now implement it in their community. So we created a community playbook, which is essentially it has different phases of how to do a whatever community engagement activity in your community by following these steps, like how to get partners on board and that kind of thing. And as part of our community pilot, we did in each community, we did a social media ad buy. And actually this year we also did traditional media, which is like TV and radio, and so these, you can see this little graphic here is one of the social media ads that we created. And over the years, we've created a lot more. We've done different gifts, and we actually have videos as well that have been playing on social media. So yeah, that's kind of like a big picture of this campaign. And this is a little old, but through more than 1,400 tweets, the hashtag Move Your Way reached almost 50 million people. And so that's probably like a year ago. We've been doing a lot more since then. But anyway, as there's new social media platforms and that kind of thing, we've expanded with our ad buy. This year we actually did have some teen materials, and we expanded into TikTok and to Snapchat. So that was exciting to see that. But otherwise, we've done Facebook and Instagram and our Google display ads and YouTube. And actually this year we did Pinterest as well. So it's been fun. So,
awesome. Thanks for walking us through that. It was great to see an actual example and kind of hear about all the different components that go in from like start to launch, and then beyond launch too. How do you kind of manage? I don't want to say finish because it's not designed to be finished. Yeah. So before we jump into student questions, is there anything or any kind of tips that you would give to current students hoping to enter the health communications field? Are there any special skills they should be developing now? What are kind of the most marketable skills? And then in addition to that, is there anything you wish you had known? Maybe not back in college, because again, we talked about it took a little while for you to kind of find your way to this spot, but maybe when you were first starting in the field, maybe in that MPH or still in school, is there anything you kind of wish you had known or engaged in back then?
Yeah, I think like definitely as someone still in college, just trying to get some experience now is always helpful, whether it's through internships or going to conferences. I know, like I said, Dr. Cynthia Bauer in the Horowitz Center for Health Literacy, like maybe she has some opportunities to come in and help out there, and just kind of like trying to better understand the field. You could do some research. I linked to this We Heart Health Literacy. You could sign up for that. It's a weekly blog that comes out, but it really it really explains basically the background of what we do. I mean, it gives you like, one example is we're trying to not say target audience anymore, right? Because they're not a target. We're not shooting at them. We're not aiming the arrow at them. They're really priority populations, or they're, so a lot of this, what we write in We Heart Health Literacy is just examples of how to better talk about health and to understand and communicate health literacy, So I highly recommend signing up for that. It comes out every Thursday, and they're just really good, and they're very short and mostly humorous as well. So I recommend reading those. Like I said, start researching companies that do this work and start seeing what they are putting out there. There's, like I said, I've kind of been to a few different agencies. I've never worked for the government directly, but definitely working for the government is an option, whether it's federal, state, or local. And like I mentioned, in health communication, there's the Health and Human Services, and then and NIH are the two big agencies. But and then I said I worked for an advertising agency, which is not something you may ever think that you would do, because like probably at the time, I also was one of the only people who had a master's degree there. And usually in the public health field, you'll have a master's degree to work places. But at the advertising agency, I really was just like the health communication expert, or subject matter expert that could provide that that expertise. And then where I am now, and where I've been probably the majority of my career, is as a consulting company, and where we get these government contracts. So I think just starting to do research, seeing what's out there, understanding the field, and trying to get some experience as you can through internships, reading resources, or going to conferences. I think that's probably some of the big items.
Well, thank you. I do want to open the floor. We've got about 20 minutes left here. And we do actually have a smaller group of participants. So if any of our student participants and guests today have any questions, I would be happy to provide you the opportunity to kind of jump on with your video and with your mic unmuted to ask a question. So if you do, you can either raise your hand or kind of pop your name in the chat. And if you don't want to be the one to ask the question and you just want me to ask it, feel free to type it in the chat as well. Okay, Melanie, I think I just unmuted you.
Hello, my name is Melody. One of the questions that I had for health communications is that, do you necessarily have to achieve a graduate degree in order to go into public health, or in order to go into health communications, or not necessary?
No, I don't. Nope, you sure don't. We definitely have people at our company that don't have their master's degree. I think probably for me personally at the time, I didn't know what I wanted to do. So it was like kind of the next step of going. But there is, I think what I would recommend too, and I mean, this isn't for everybody, is getting your undergrad, then getting some experience, and really like, is that really what you want to do? And kind of figuring that out before you jump straight into your master's program. But a lot of people don't. A lot of people do just go straight from undergrad to the graduate program. But I liked getting that experience in between and kind of really figuring out what I wanted to.
That's the plan that I want to do. That's why I was asking, because I know, for instance, in a lot of my classes, they're really pushing towards us getting that higher degree, but I still don't know what I want to do. So I was like, wait, in health communications, is it like really pressed that we have to get that graduate degree, or can we kind of go and figure out what we want to do? And then if we want to proceed, then.
Yeah, I think I have seen it, that you don't need your graduate degree in this field to get a job. And I just linked the careers that communicate health right now. This is what we have right now, but we're always hiring at our company. So yeah, so take a look at that.
All right, thank you very much. And by any chance, are you guys offering any internships in the summer?
So I know we've had interns in the past. I don't think we did this past year, but I would definitely recommend, I wonder if there's just a link. I mean, you can always email me too, and I can put you in touch with someone. I was just trying to see if there is a general link. But I'll put my email address in here, and then I could always put you in touch with somebody.
All right, thank you very much.
I don't know if, with COVID, if we didn't have any last year because of that.
Melody, that was a great question or point. I think Dina talked about as well, the idea of, do you go straight into the MPH if you kind of have an idea that you'll go back, or do you take some time? And I think when you get to that graduate level, typically a more targeted, focused degree with a direct intent on kind of where you are going after receiving the degree. And so, yeah, if you know exactly what you want to do and you have no doubt and you've had a lot of experience in it already, either through internships or volunteering, going straight into it is going to reduce your time to get into the career. But if you're still not quite sure, taking a little bit of time and not jumping into something and then finding out halfway through that it's actually not what you want to do, but you've invested the time and the money, it might be worth it at that point to take that year, maybe 2 years, get some experience in the field, and get a better perspective on whether or not that specific path is right for you, or if there's, some other slightly modified or slightly different path as well.
Yeah, we actually have multiple employees now who did not have their graduate degree and are now going back, and they're doing both, working and getting their degree, but on a reduced schedule and that kind of thing. And then often a company may pay or give you some sort of stipend to get your degree. So that's helpful.
Great point, Dina. Does anyone else still here have any questions, or any other, whether it's directly about your own career path or whether it's about the field more broadly or about the organization?
I will make a quick plug too I think you might have said it earlier, I'm not sure, but I am on the School of Public Health alumni board as well. So, that we're always putting on events for different alumni to engage folks. But also I know Lauren has helped with, I forget what we were calling it, but there's different career opportunities, and I've participated in different panels on campus. So I think those are other places that you can, just like you're doing here, just learn from people in the field, what it looks like and that kind of thing. So always take advantage of those opportunities.
Yes, I think, Dina, you're talking about the night of networking that we do in the spring. And then we also, so that's kind of one of our flagship events that I do work with the alumni board on. And then the Public Health Career Expo is also coming up. So that'll be November 3rd. That's a great opportunity to go talk there will be employers, there will be volunteer organizations, there will be graduate schools, so just getting a chance, even if you're not immediately looking for a job, just getting a chance to get some exposure to different, organizations and learning about them is a great idea. So I'm also just going to plug that event. And then the night of networking does happen in the spring. I don't have an official date for that, but it's typically the first Thursday in April. So just be looking out for that as it comes around. Oh, I see Allison has her hand raised, so I'll ask her to unmute.
So my question is, how has like the public health field changed in the years that you've been working in it? And like, does your company find itself having to like change strategies a lot due to developments like COVID and changes in politics and the media?
Yes. Yeah. I mentioned this, when I started, we had the internet, but anyway, with the addition of social media and how social media changes or different platforms or keeps changing. I think I even said, I think it was today in a meeting that we were talking to our client about developing social media ads, and like 2 or 3 years ago when the Move Your Way campaign launched, we were making videos that went on social media that were 90 seconds, and now we're trying to make them much shorter, not even, maybe even 15 seconds. So even within the span of 2 years, at least, like the technologies and that kind of thing, you have to be on top of. And then like regarding COVID, and this is not specifically COVID, but just being able to, just with the changing environment, probably with any job, you have to change quickly. And in terms of COVID, is that we had this public facing campaign. We were just, I think actually it was the beginning of March 2020, we had just launched some new ads in our communities, just showing people being active without masks on. And then, very quickly we realized, okay, these are not going to work. So we had to pause the campaign and shift very quickly and create new ads and new messaging and that kind of thing. So that changes. And I guess one thing when I talked about like these researchers or people who are like scientists who are very, they hold on to their data very, very tightly, and they don't want to change up, make simple messages out of their data. That I have not seen change over time, but maybe it will. Just as what we try to do too at our company is do client education and like, share these best practices, and this is what we're seeing work with people. So, I think there's just, like I said, the client education piece and making sure everyone understands those best practices today.
Great, thank you.
Thanks, Allison. Does anyone else have any other questions today? We still got a little bit of time, but if you feel that you've used your time to the extent that you want to, we can also give that time back to you. And again, this recording will be available once I upload it. It's usually about 48 hours. So, but I'll also email anyone who was on today or was registered for the event as well. Okay, well, with that, Dina, is there any last thing that you'd like to say or plug or leave our attendees with today?
No, well, just, take a look at our website. I think there's just a lot of good information there. It's not the end all be all, but like I said, just trying to even go to conferences or even reading different abstracts at conferences on their websites and stuff, and just being a student, like those things are pretty cheap for students. So if you can just get out there and kind of be a sponge and absorb everything now while you're still considering what you want to do when you get out of school, I think now's the time to do it and take advantage of, especially with everything being virtual too. A lot of these conferences are virtual and don't require a lot of travel, which obviously increase costs too. So
and a lot of memberships do have discounted rates when you're a student. So it's an excellent thing to get into now. Well, thank you so much, Dina, for being with us. And thank you for everything you do for the school too, as a member of the alumni board and for other events. We're really happy to have you with us today. And I hope you enjoy the rest of your day.
All right. Thank you, everybody. Good luck.
Okay. Bye.
Bye.